Welcome. This is Medical Minutes brought to you by Passavant Area Hospital. This is actually our first inaugural broadcast, and I would like the listeners to welcome Dr. Marshall Hale, who will be talking about influenza and the flu vaccine. A little bit about Dr. Hale, and the reason why I chose Dr. Hale to speak with us today is he is the chairman of the Infection Control Committee here at Passavant Hospital. Dr. Hale is a family practitioner, board certified, and he's with Memorial Physician Services. I believe Dr. Hale had the pleasure of experiencing his 30th year in practice this last summer. He's also been on many committees here at Passavant. He's been on the Medical Executive Committee, he's been in the Performance Improvement Committee, and he's been staff president. We'll jump right in here today, and we're going to go to the actual meat of the subject matter here and exactly what is influenza. There's a lot of common misconceptions out there, and commonly people mistake a lot of the signs and symptoms of the common cold for influenza. So I'll ask Dr. Hale exactly what is influenza.
Good morning, Dr. Russotto, and good morning to all the listeners. That's a great question, and you're absolutely right. Most people talk about the flu when they've got a little nausea, a little bit of diarrhea, a little runny nose, but actually the flu is a lung infection that invades through the lining of our nose and our lungs and causes most of its damage in the lung, causing high fever, usually a sudden onset, 103, 104 degrees, associated at the same time with a really profound cough. And those are the two main symptoms that last 3 or 4 days. You may have some other additional symptoms, headache, weakness, fatigue, lack of appetite, but it's not vomiting and diarrhea as most people talk about.
Would you say, though, that a big difference between the common cold and the true influenza is the high-grade temperatures? Is that one way to really differentiate the two?
Absolutely. Common cold is also a virus, mainly affects our nasal passages. Nasal congestion, drippy nose, mild sore throat, low-grade fever, 100 degrees. Symptom onset with a cold is real gradual. You feel a little achy. The next day you may have a little nasal congestion, sore throat maybe the third day. The flu really is a violent infection. It's the way that the virus works. You take in a few particles, they penetrate into your lung. They live in the lung cell for about 8 hours. But when they come out of that lung cell, killing the lung cell, one virus goes in, 1 million come out of each cell. Of course, when those 1 million come out, they infect 1 million lung cells. So the next go-around in another 16 to 18 hours, you have a huge number of lung cells that are dying. And that's why the cough and the fever come on so quickly. You are suddenly severely ill in a period of about 3 or 4 hours.
Okay. So who actually is at risk then, though? I believe comorbidities play a big role in a person afflicted with influenza. Is that correct?
That is correct. Unfortunately, all of us that are alive are at risk for the influenza. Those that don't do as well if they get infected with influenza are the really young, infants, young children, the elderly. I appreciated the introduction, being here 30 years. I'm approaching that time of being elderly. I do get my flu shot every year. And then anyone that has an illness that would weaken their immune system. Diabetics are susceptible, more likely to have a bad outcome. People with chronic lung disease, chronic smokers, people who may be undergoing chemotherapy for cancers. All of them have weakened immune systems. So as the virus comes in, their immune system starts to try and kill the virus. Their immune system doesn't kill as quickly as a healthy person, so the virus has a head start.
Yeah, isn't it true even patients who are on long-term steroids, something like that would be at increased risk also?
That's also right. People with chronic arthritis that need those steroids, Crohn's disease, inflammatory conditions that need steroids. Steroids weaken your immune system.
Do you have any facts and figures of the mortality and morbidity of the influenza in the United States?
I do. On a pretty typical basis across the country, anywhere from 20 to 35,000 people die from the influenza. Now, again, they tend to be really older people who have really declined with their immune systems, but there can be young, healthy adults, 25, 35. I've had patients like that. I've had neighbors out in the community that were healthy, got the influenza, and unfortunately passed in their sleep. It's not often, but it can happen.
Well, with any disease process or pathology, physicians always like to talk about the preemptive step, which is prevention. It's always easier to prevent a disease probably than to deal with it afterwards. So what are some of the ways that our listeners can reduce their risk of getting the flu?
When the flu season starts, they're going to know that there's more people in the community that are ill with the flu. People will be talking about it. They'll see people coughing, fever, out of work. So they know it's out in the community. That's the time to be really vigilant with what we call personal space and avoidance of close contact with other people. If you cough or sneeze, you should cover your cough so you don't transmit. If you see people sneezing and coughing who aren't covering their cough, those people need to be avoided. Good hand washing techniques. People cough on their hands, they touch the doorknobs, then the doorknobs are infected for several hours with that virus. So when you're out in the community and it's influenza season, you have to consider all surfaces as potential sites of infection. You don't want to be eating out in public unless you've washed your hands before you eat. You want to try to avoid touching your face and nose if you've touched other objects while you're out in the community, and then avoid people that are obviously ill.
So technically, I mean, even just using those hand gels and soaps that people can commercially buy is a good way also?
Yes. The alcohol scrubs are very effective. You can get a little bottle, carry it in your pocket or purse or in your car. You get ready to eat at a restaurant, a little bit on there, hands are clean.
And, there's always these misconceptions about who is contagious and when they become contagious. My understanding is actually somebody can be contagious 24 hours before that they even have the onset of their own symptoms, and then probably the 7 days of the course of the viral infection. Is that correct?
That's absolutely correct. And that's one of the big reasons that Passant Hospital has been so aggressive at having their employees be immunized, thereby reducing the risk that they will have the infection themselves, because they can be infected and transmit virus 24 to 48 hours before they have symptoms. And about 15% of people who get the influenza have almost no symptoms, so they don't realize that they're sick. They can come to work and transmit to patients who are expecting us to take good care of them. So at Passavant, we mandate this year that all staff, physicians included, are either vaccinated or wear protective gear so they don't infect the patients.
So basically, if you had to bring it down to the layman's terms, who should and should not get the flu vaccine?
Anybody that's 6 months old should be a candidate for the flu vaccine. Some special cases need to be discussed with their physicians if they have an illness that may cause them to have a more significant reaction with certain of the flu vaccines. Some of the live viruses need to be used in caution with asthmatics or chronic lung disease. But basically, if anybody's 6 months old or older, they need to be discussing with their healthcare provider, I need a flu vaccine. What kind's best for me, and is it time to get it? The answer is it's time now to get it.
Yeah, and there's the different types of vaccines. There's the mist and there's the high dosage. Can you tell us a little bit about those differences?
Sure. The majority of the virus injection that's used is just the standard single dose. It's utilized from 6 months up through age 65. It's an injection, fairly painless. Also, the other injection is for people 65 and older. Their immune systems have weakened a bit. They need a little bit more of a stimulus to trigger that immune system to get really aggressive. And so 65 and older gets a vaccine that's called the high dose. It's got extra virus particles in it. They're not alive. They're all been processed, so they're dead. But it gives their immune system a better chance to make a better response. The flu mist is for people who are adverse to an injection. It's for a certain limited number of people, usually the pediatric population over 2 years of age. Again, that's something they need to discuss with their healthcare provider.
But of course, there's always that myth. I got the flu vaccine, and 2 days later, I got the flu. Can you dispel that myth?
That happens to people. It's not from the vaccine. The vaccine's not perfect. About 5 to 8% of the people who take the vaccine, unfortunately, won't develop any immunity. So that person that I encourage year after year to get the flu vaccine, they finally consent this year to do it. If they're exposed, they have a small risk the vaccine didn't work, which means they will take the virus into themselves. They'll get the actual full-blown flu in bed, 4 or 5 days, high fever, bad cough. And they'll tell a lot of people, Dr. Hale made me get the flu shot, and this year I got the flu. True statements, but they're not connected.
Okay. There's the difference, like I said, in the different flu vaccines, but we talk about the different types of flu from year to year. How does that come about?
Yeah, the numbers are always confusing. In 2009, we had the so-called swine flu, the H3N1. We've got the bird flu, H5N1. The scientists named the influenza through a standard pattern that all the researchers around the world and government agencies can understand. There are two components on the outside of the flu virus that hang off like little dingleberries, and they help the virus penetrate into our lung tissue. And the viruses change those a little bit each year, trying to hide from our immune systems. And as they change, we can analyze them, and the different ones are labeled with a letter and a number. The flu vaccine this year predominantly has the virus from 4 years ago, the H3N1 so-called swine flu. And then it also has two other components. One's influenza B and another old 1968 influenza A virus. So it changes. It's easy to talk about it that way, but it's kind of hard to understand exactly what that number means. The scientists understand it. I just pay attention to the numbers.
What are the risks of the flu vaccine then?
The flu vaccine is an extremely safe vaccine. As I mentioned, it is a processed and dead vaccine, so it cannot cause any infection in us, not the influenza. A sore arm happens in about 10-15% of people. A little bit of redness, a little bit more common in children than in adults. That's just their immune system looking for that virus that we injected, starting to build itself so that it can kill the virus. You may be achy. You may have a low-grade fever of 100, less than 10% of people that have that.
Isn't it also true, though, because a lot of times there's many different strains of the flu that can come about, and of course scientists anticipate what's going to be coming to the United States. But I want our listeners to understand, though, even though when they get the vaccination, they can still get the flu if a different strain comes about, but there is some protection because they have already had some immunity because of the flu vaccine. Is that not correct?
That's correct. Those listeners who get the vaccine every year begin to build up some general immunity just to the virus itself. So if they get exposed to and take in a strain that this vaccine doesn't necessarily kill, some of the crossover antibodies from previous vaccines do help some. Each year, the scientists around the world look for our interest to the southern hemisphere, South America, Africa, because they're having their flu season while we're in summertime. They look what's circulating, and typically that virus comes north. So our government, the flu manufacturers, take that virus and make vaccine for us here in North America, which is available now.
So they basically anticipate what's coming.
Educated guess, absolutely.
Yes, okay. Where can one obtain the flu vaccine?
It's pretty widely available. All the pharmacies in town have them. Providers typically have them. The hospital has it. The health department, they've had a really heavy run on vaccine, but it's still available in the community and easily available at any of the pharmacies.
Okay, Dr. Hale, we're going to be wrapping it up here. You gave us some really great information. One of the things that I take away from this conversation here today is, of course, common sense measures about what to do during the winter season and prevention and hand washing. Is there anything else you'd like to add to that?
I would really encourage everyone to consider getting the flu vaccine. As I mentioned earlier, some of us will get infected if we don't take the vaccine and won't have any symptoms. We can pick this up in the community and then bring that home to our families and make our families ill. Those of us that have the ability to take that vaccine really owe it to the community and our families to get vaccinated so we're not spreading it amongst each other.
Well, thank you very much, Dr. Hale, for that great information. I just want to tell the listeners for the next program coming up, our broadcast will be about breast cancer, and we're going to have Dr. Daniel Hallam, who is a general surgeon here at Passavant. Thank you very much for listening.